Welcome to the We Level Up Treatment Center video series. In today's video we will discuss Ativan versus Xanax. Both Ativan and Xanax medications are generally prescribed for anxiety. These medications calm the brain but carry addiction risks for more extended use. These anxiety medications can deliver effective relief for people undergoing anxiety attack treatment. Ativan and Xanax are among the more prevalent benzodiazepines or benzos that psychiatrists prescribe to anxiety-diagnosed patients. However, they are also among the more abused prescription medications in their category. What is Ativan? Ativan, Lorazepam, is a prescription tranquilizing drug and sedative hypnotic or anxiolytic medication. Ativan is used for anxiety treatment. It is in a class of drugs called benzodiazepines. It works by slowing activity in the brain to allow for relaxation. Many have developed Ativan addiction and require Ativan detox to function normally again and avoid Ativan side effects that bring health risks. Ativan is the brand name available in the US for Lorazepam. Loraz, another brand name for Lorazepam, has been terminated in the US. Ativan is available in generic form. However, you need a prescription from your doctor. Despite its legitimate medical uses, Ativan has known addictive and drug dependence drawbacks. This is one reason Ativan is prescribed for relatively short-term use, and it is not suggested to have Ativan long-term. However, people should be careful to adhere to prescription guidelines. If an individual exceeds the recommended dosage or can't stop their long-term use of Ativan, it may increase the likelihood of drug addiction development. Ativan recreational use is not rare. Ativan is a DEA-controlled drug. The active ingredient, Lorazepam, is a DEA Schedule IV controlled substance. Given that, substances in the DEA Schedule IV have a low potential for abuse relative to substances in Schedule III. The DEA also classifies Ativan as a depressant. However, this doesn't mean that it is in any way less dangerous and addictive. The street names for benzodiazepines, including Ativan, are benzos, downers, nerve pills, and tranks. What is Xanax? Xanax, a brand name for Alprazolam, is a potent and the most commonly prescribed benzodiazepine, benzos, that is only recommended for up to 6 weeks. It is used as a prescription for anxiety treatment. Xanax is also prescribed for panic attack treatment. Taking the generic form of Xanax or other forms of Xanax can lead to physical dependence and addiction. Furthermore, withdrawal is one of the most common Xanax side effects. Withdrawal may be experienced when someone reduces or stops using this prescription drug, leading to complications such as panic attacks, insomnia, and seizures. Withdrawing from Xanax under an inpatient drug rehab specializing in Xanax detox reduces the risk of complications and helps the individual experience a safer, more comfortable recovery. Medications like Xanax work by decreasing abnormal excitement in the brain. Xanax slows down the movement of brain chemicals that may have become unbalanced, reducing nervous tension and anxiety. Xanax boosts the effects of a natural chemical called gamma-aminobutyric acid, made in the brain. Is Xanax versus Ativan for anxiety treatment? The following medications are all options for anxiety that are alternatives to addictive benzodiazepines. Drugs like Xanax that aren't addictive are SSRIs, SNRIs, buspirone, beta blockers, pregabalin, gabapentin, hydroxyzine, Panax, and diphenhydramine. Xanax versus Ativan differences. There are some differences between Xanax versus Ativan. The difference between the two medications include the following. The onset of effect. Xanax has a quicker onset of effect than Ativan, which means it starts working faster. Xanax takes 15 to 30 minutes to begin working, whereas Ativan takes 30 to 60 minutes. Duration of action. Ativan has a more prolonged action duration than Xanax. Ativan can last up to 8 hours, while Xanax's effects typically wear off in 4 to 6 hours. Sedation and performance impairment. Both Ativan and Xanax have a risk of sedation and performance impairment. However, Ativan is generally considered more sedating than Xanax. Therefore, Ativan may be more likely to cause drowsiness, while Xanax has a higher probability of causing impaired coordination and cognitive function. Dosage. Ativan is typically prescribed in lower dosages compared to Xanax. The starting dosage of Ativan is usually 0.5 mg to 1 mg per day, whereas Xanax's starting dosage is 0.25 mg to 0.5 mg per day. Approved uses. Ativan and Xanax are approved by the FDA, Food and Drug Administration, for different purposes. Ativan is approved to treat anxiety disorders and insomnia and is a pre-anesthetic medication. Xanax is approved to treat anxiety disorders, panic disorders, and anxiety associated with depression. Dependency and addiction. Ativan and Xanax have a high risk for dependence and addiction when used excessively or outside the prescribed guidelines. Long-term use of either medication can lead to withdrawal symptoms, including seizures, rebound anxiety, and insomnia. Xanax versus Ativan similarities. Ativan and Xanax are very similar medications used to treat similar conditions. Doctors choose one drug over another based on individual needs, such as duration of effect, sedation, and performance impairment. Following your doctor's guidance is essential. Discuss any medication or dosage changes before making them with your doctor. In case of discomfort, adverse effects, or any query related to both medication, discuss it with your doctor urgently. What is stronger, Xanax or Ativan? Alprazolam versus Ativan, which is stronger? Ativan or Xanax? Although neither medicine is more potent, their differing durations in the body and action rates necessitate different dosages. Ativan and Xanax are both benzodiazepines used for the treatment of anxiety, and both are equally efficient for this use. The differences are that Xanax has a quicker onset of effect but a shorter duration of action versus Ativan's a longer duration. Can you take Ativan and Xanax? Because Ativan and Xanax are benzodiazepines, they should not be taken together. One medicine may be more beneficial than the other, depending on the type of anxiety illness. Regarding anxiety treatment, Xanax is better than Ativan, Lorazepam, best suited for patients who require many hours of drowsiness. Neither medicine, however, should be taken for long-term therapy. Ativan side effects. The cumulative effects of Ativan use or abuse can cause health problems. It can have an impact on a person's memory. Ativan can be habit-forming, so using it as long-term treatment isn't advised. Ativan is one of the more challenging benzodiazepines to withdraw from. Taking it for long periods is especially risky, potentially causing addiction. Those with alcohol or substance abuse problems should not be prescribed Ativan. It can cause serious health problems, which include falling into a coma or death. People taking Ativan for long periods say it gets less effective over time, causing people to abuse the drug to obtain its continued benefits with an ever larger dose needed for the same effects. Ativan comes with side effects such as temporary drowsiness, dizziness, and confusion. Physical and mental exhaustion. Temporary drowsiness, dizziness, and confusion. Physical and mental exhaustion. Xanax side effects. Is Xanax a downer? When taking Xanax, the body produces far less GABA. This is the body's natural calming capabilities. The dependency is swift, and it's not exceptionally safe to withdraw from benzodiazepines alone. The Xanax high comes with its risks as well. Xanax versus Ativan? Like any benzodiazepine, it can offer a nice sedative high that people are drawn to. Overdose of Xanax is possible when someone takes more than the recommended dose. It may also occur when someone stops and then restarts using Xanax. Mixing Xanax with other depressants like alcohol or benzos can be extremely risky, causing death. Common Xanax side effects include potential tolerance and habit-forming tendencies. Can cause slurred speech. Fatigue. A change in sex drive. Respiratory depression that leads to shortness of breath. We Level Up NJ Treatment Center specialists can provide information on dual diagnosis and detox programs to treat Ativan and Xanax withdrawals. Each call is private and confidential. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.